Hey guys, this is Dr. Hub. Today we'll look at the types of porphyria. Types of the porphyria. So clinically they are divided into two, that is a hepatic porphyria. So there is the hepatic porphyria as well as the presence of the erythropoietic porphyria. So there is also the erythropoietic porphyria. So in terms of the hepatic porphyria, this is caused due to the enzyme deficiency. So it is due to the ED, that is enzyme deficiency. It is early in the pathway of heme synthesis. It is early, and this is in pathway. So it is early in pathway of the heme synthesis. And there is an accumulation of the ALA and PBG. So there is accumulation, and this is of the ALA and PBG. So the patient, they present with the neurovascular symptoms. So they present with the neurovisceral symptoms. Then we look at the erythropoietic porphyria. So in terms of the erythropoietic porphyria, so this is caused again by the enzyme deficiency, and it is late in the pathway of heme synthesis. It is late in pathway of heme synthesis, in pathway of the heme synthesis. So there is an accumulation of the porphyrins which leads to the cutaneous photosensitivity. So there will be an accumulation. So there is an accumulation, and this is of the porphyrins. The accumulation of the porphyrins, and it leads to the cutaneous photosensitivity. So there is the cutaneous photosensitivity. Now let's look at the types of porphyrias. So this will be a flow chart. So there is the glycine as well as the succinyl CoA. So both of them, they combine, and it leads to the aminolevulinic acid. So in short, it is known as the ALA. So here, what is involved? So here there is a X-linked protoporphyria. So there is X-linked protoporphyria, and then comes on the other hand, there are some inhibitors. So there is ALA synthase which is acting here. There is ALA synthase, as well as on the other hand there is the X-linked protoporphyria which we just saw, and this in short is known as the XLP. Next is the conversion of the aminolevulinic acid to the porphobilinogen. There is porphobilinogen. So porphobilinogen is nothing but, in short, it is known as the PBG. And what is acting here? What is acting here is the ALA dehydratase deficiency porphyria. So there is a ALA dehydratase deficiency protoporphyria, that is the ADP. So what is the enzyme here? It will be the ALA dehydratase. It is the ALA dehydratase. So what we saw was the aminolevulinic acid converted to the porphobilinogen, and the enzyme here was the ALA dehydratase, and the porphyria, it involved the ALA dehydratase deficiency porphyria. Next is from the porphobilinogen, we are looking at the hydroxymethylbilane. So it is converted to the hydroxymethylbilane. So here what are we seeing? So here there is a AIP. So AIP is involved, AIP stands for the acute intermittent porphyria. There is acute intermittent porphyria. So acute intermittent porphyria is nothing but the AIP. So it's acting here. And what is the enzyme involved here? The enzyme involved here is a hydroxy methylbilane synthase. So hydroxy methylbilane synthase. Next, we move on to the hydroxy methylbilane. So the hydroxy methylbilane to the uroporphyrinogen 3. So this is converted to the uroporphyrinogen 3. Uroporphyrinogen 3. So what is involved here? So there is addition of the CEP. There CEP, that is the involvement, the congenital erythropoietic porphyria. This is congenital erythropoietic porphyria. And there is what is involved here? The enzyme is involved is the uroporphyrinogen 3 synthase. Next is we look at the uroporphyrinogen 3. So uroporphyrinogen 3 to the coproporphyrinogen 3. Coproporphyrinogen 3. So here there is the PCT, that is a porphyria cutaneous tarda is present here. And what is the enzyme involved here? Enzyme involved will be the uroporphyrinogen decarboxylase. Uroporphyrinogen decarboxylase. Then comes the presence of the from the coproporphyrinogen. So it goes from the coproporphyrinogen to the protoporphyrinogen 9. So to the protoporphyrinogen 9. So what is involved here? So here the porphyrias involved is the hereditary corpoporphyria. So there is hereditary corpoporphyria. So it is nothing but the HCP. And what is the enzyme involved here? The enzyme involved here is the coproporphyrinogen oxidase. So this coproporphyrinogen oxidase. Then the protoporphyrinogen 9 is again converted to the protoporphyrin. So protoporphyrin. So this is protoporphyrin 9. So what is the porphyria here? It is the variegate. It is nothing but the variegate porphyria. So variegate porphyria stands for the VP. Next, what is the other thing present here? So the enzyme here is nothing but the protoporphyrinogen oxidase. So the enzyme is the protoporphyrinogen oxidase is the enzyme. The last step you are seeing is the protoporphyrin 9. So there is the protoporphyrin 9. So this protoporphyrin 9 is converted to the heme. It is converted to the heme. So what is the porphyria? The porphyria is nothing but the erythropoietic. There is erythropoietic protoporphyria. So erythropoietic protoporphyria is known as the EPP. And what is the enzyme which is involved here? It is the ferrochelatase. Now, to make it simple, let's look at the porphyrias. So there is a X-linked dominant protoporphyria. This will be just recapping what we did. So in the X-linked dominant protoporphyria, the enzyme deficient will be the amino levulinic acid synthase 2. So amino levulinic acid synthase 2. So what will be the lab finding here? The lab finding is there is a decreased RBC count. So there is a decrease in the RBC count as well as the hemoglobin. Next is, what are the symptoms? The symptom is there's presence of the photosensitivity. So there's presence of the photosensitivity. Next, we move on to the amino levulinate dehydrogenase deficiency. So we are writing short forms because we have already discussed the amino levulinate dehydrogenase deficiency porphyria. So we are writing it as ALADP. So here the deficiency is with the ALAD, that is the amino levulinate acid dehydrogenase. We are writing it as ALAD. So in the ALADP there is increase in the urinary ALA. So there is increase in the urinary ALA and the coproporphyrin, the coproporphyrin 3. Next is, what are the symptoms? The symptoms involved are there is a abdominal pain as well as there is presence of the neuropathy. Next we move on to the acute intermittent porphyria. So AIP stands for the acute intermittent porphyria. So here the deficiency is the hydroxymethylbilane synthase. So hydroxymethylbilane synthase. So this is nothing but the uroporphyrin 1 synthase. So it is a uroporphyrin 1 synthase. And what is the lab findings of the AIP? The lab finding is that there is an increase in the urinary ALA and PBG. So increase in the urinary ALA as well as the PBG. So now what is the features, the symptoms? The symptom is there is a periodic abdominal pain. So there is a periodic abdominal pain. There is PN, there is peripheral neuropathy. There are some psychiatric symptoms as well as there is presence of tachycardia. Next, we look at the congenital erythropoietic porphyria. So what happens in the congenital erythropoietic porphyria? So in short, we are writing it as CEP, the congenital erythropoietic porphyria. So the deficient enzyme here is nothing but there is a uroporphyrinogen. So there is uroporphyrinogen. This is 3 synthase. So there is uroporphyrinogen 3 synthase, and this is nothing but the UROS. And what is the lab findings? The lab finding here is there is an increase in the urinary. So in CEP SIP there is increase in the urinary. There is fecal as well as the red cell uroporphyrin. So there is increase in the fecal, urinary and red cell uroporphyrin, and this will be uroporphyrin 1. So here we saw it is uroporphyrin 1, and what will be the symptoms? And the symptoms will be there is presence of the cutaneous, photosensitivity, as well as there can be severe photosensitivity. So the severe photosensitivity is along with the erythema. So there is presence of the erythema, as well as there can be presence of swelling. So there can be swelling and also the blistering. So there can be presence of swelling, there can be blistering as well as the photosensitivity with the erythema. Next, there is presence of the hemolytic anemia. There is presence of the hemolytic anemia as well as the presence of the splenomegaly. Next, we move on to the porphyria cutaneous tarda. So in short, we are writing it as the PCT. And what is the enzyme deficient? Enzyme deficient is UROD. UROD stands for the uroporphyrinogen decarboxylase. So UROD is the deficient enzyme, that is uroporphyrinogen decarboxylase. So what is the lab finding here? The lab finding is that there is a increased uroporphyrin. There is increased uroporphyrin 1. Uroporphyrin 1 is increased, and there is the features are there is cutaneous photosensitivity as well as the photosensitivity, and this is the vesicles and the bullae. So, the presence of vesicles as well as the presence of the bullae. Next, we move on to the hereditary coproporphyria. There is hereditary. So, there is hereditary coproporphyria. So, in hereditary coproporphyria, it is nothing but the HCP. And what is the enzyme? The enzyme involved is the CPOX. So, what do you mean by CPOX? The CPOX is nothing but the coproporphyrinogen. So, this coproporphyrinogen, and this is nothing but the oxidase. Now, what are the features? So, the lab findings here are the increased urinary ALA. This increased urinary ALA, there is PBG as well as the coproporphyrinogen 3. Porphyrin 3, and there is also the fecal coproporphyrinogen 3. Fecal coproporphyrin 3. So what are the features here? It involves both, that is, there is photosensitivity as well as the neurological symptoms. There is neurological symptoms and the abdominal colic. Then we move on to the variegate porphyria. So variegate porphyria, in short, we are writing it as VP. So variegate porphyria, the enzyme defect will be the PPOX. So what is meant by PPOX? Is nothing but the protoporphyrinogen oxidase. There is a protoporphyrinogen. This is oxidase, protoporphyrinogen oxidase. So what will be the lab finding here? The lab finding will be there is an increase in the urinary. So as increase in urinary ALA, there is PBG as well as a coproporphyrinogen 3. There is coproporphyrinogen 3 and the fecal protoporphyrin 9. Fecal protoporphyrin 9. So what are the clinical features? There is presence of the photosensitivity, and there are some neurological symptoms as well as there is DD, that is a developmental delay. Next we move on to the erythropoietic protoporphyria. There is erythropoietic protoporphyria. So in terms of erythropoietic porphyria, it is nothing but the EPP. So what are the enzymes which is involved? The enzyme involved is nothing but the ferrochelatase. This ferrochelatase. So in short, it is known as a FECH. And what are the features? The lab finding is nothing but there is an increase in the fecal and red cell. There is increase in the fecal as well as the red cell protoporphyrin 9. Fecal as well as the red cell protoporphyrin 9. So what are the symptoms? The symptoms is there is cutaneous photosensitivity as well as the presence of there is non-blistering. There is non-blistering photosensitivity as well as presence of the skin lesions. Next, let's look at some porphyrias with the autosomal dominant. So majority are autosomal dominant, except there are some exceptions. So exceptions, it includes the ALAD. So ALAD enzyme ALAD, enzyme deficiency, porphyria. Next, there is also the congenital erythropoietic porphyria. There is congenital erythropoietic porphyria. Next is there is the erythropoietic protoporphyria, as well as then there is a X-linked protoporphyria.